If your MRI is normal, your low back pain is one-sided, doesn't shoot into your feet, and gets worse when you sit too long or stand still, you may be chasing the wrong culprit. Up to 15 to 30% of chronic low back pain cases aren't coming from the spine at all. They come from the sacroiliac area, the mighty weight transfer joint between your pelvis and spine. Today, we'll uncover why it's so often missed, how we actually confirm it, and how to move from fear to function. I'm Dr. MovingBetter, Physiatrist. Let's get you clarity and momentum. SI joint pain hides in plain sight. Its symptoms mimic disc problems, hip arthritis, even piriformis irritation, and most imaging, X-ray, CT, MRI, looks completely normal. So when patients hear everything looks fine, they're left with pain, but no explanation. If this sounds familiar, listen closely. Standing still, like when you're waiting in line at the grocery store or washing the dishes, you start feeling a deep, dull ache build until you're finally forced to shift weight to soothe the pain. When you're sitting still too long, the same thing happens, forcing you to fidget or lean to get some relief. And here's the one that drives people crazy: sleeping. When you sleep on your side without moving much, your body weight bears down on one SI joint for hours. The sustained strain causes pain that wakes you up. You end up having to turn and adjust constantly just to get relief, which means you're not truly resting. That pattern of pain under sustained pressure, relief with motion, is the fingerprint of SI joint ligament stress. Recognizing it is step one toward a real diagnosis. So naturally, the next question is, what causes sacroiliac pain in the first place? We can divide the causes into three categories: traumatic, biomechanical, and inflammatory. Falls onto the buttocks, car accidents, or sudden heavy lifts can jolt the sacroiliac region and its ligaments. Even without visible injury, those structures get stressed. Repetitive, uneven loading from running, golf swings, or anything with one-sided loading that produces small shearing and torsional forces over time, like bending a paperclip back and forth until it finally gives. Twisting while both feet are planted or stumbling forward and catching yourself can sprain the sacrotuberous or sacrospinous ligaments that stabilize the joint. The SI joint acts as a shock absorber, transferring upper body weight into the legs. When that balance is off, pain develops. Think of when there is a leg length discrepancy. If one leg is shorter than the other, then there is uneven stress across the joint and its supporting tissues. Now you're walking unevenly due to gait abnormalities, scoliosis, and pelvic tilt. Then shift forces unevenly, forcing ligaments to absorb more strain. Here's one that surprises people: hip problems. Research shows that around 50 to 60% of younger adults with SI joint pain also have underlying hip structural issues. When the hip doesn't move properly, the SI joint bears the burdens. Pregnancy is also a risk factor for sacroiliac pain. You see, in the third trimester, higher relaxin levels loosen ligaments, while weight gain and increased lumbar lordosis add load, increasing the risk of sacroiliac pain. Another under-recognized cause is prior lumbar fusion. When part of the spine is fused, the SI joint below becomes the new stress point. Studies show radiographic degeneration in approximately 30 to 70% of post-fusion patients. Sometimes the cause is physiologic rather than mechanical. In this category, we look at inflammatory and systemic conditions. The classic one is ankylosing spondylitis, which involves both SI joints and may eventually fuse them. Morning stiffness that eases with movement is the hallmark sign. Other inflammatory diseases include psoriatic arthritis, reactive arthritis, and arthritis linked to inflammatory bowel disease. Each can involve the SI region. We also rule out infection and rarely tumor. Finally, there is natural wear and tear. Osteoarthritis becomes common with age as joint cartilage naturally wears down. Now, here's what's important to understand. In many cases, we don't find a single cause. Often it's a combination, maybe a small leg length difference, a running habit, or a pregnancy. Those factors stack. And in a significant number of patients, the underlying cause is idiopathic, meaning the cause is unknown, but that doesn't mean it can't be treated effectively. So now that we've looked at what causes SI joint pain, the next question is, what's actually generating the pain you feel? For years, people assumed it was purely the joint, but newer research reveals a deeper story. Let's look closer at the real pain generator hiding in plain sight. The SI joint's job is to stabilize and transfer load from your upper body to your legs. To do that, it relies on a network of strong ligaments and tendons acting like ropes and shock absorbers. But here's the twist. Research suggests what we call SI joint pain often isn't coming from the joint itself. Instead, the pain is most likely coming from the ligaments and supporting tissues. Experimental studies show that stimulating those ligaments can reproduce classic SI region pain, and numbing them makes it disappear. So when someone comes to see me with low back pain, I need to figure out if the SI joint region is the source. It's like being a detective. We gather clues, rule out other suspects, and build a case for what's actually happening. Let me walk you through how we do it. Your doctor will start with a series of physical examination tests. No single test can prove SI joint region pain, but a cluster of 3 or more positive tests, especially if one is the thigh thrust or compression, makes the diagnosis more likely. Add the Fortin finger sign, pointing to the spot just inside the back dimple, and the pattern tightens further. But it's still not absolute proof, because other structures like the hips and lumbar spine can complicate the findings. Imaging doesn't confirm SI dysfunction. It helps rule out other causes. MRI and CT are excellent for spotting fractures, tumors, or spondyloarthritis, but a normal scan doesn't mean your pain is imagined. It means the problem is functional. When we need more clarity on the diagnosis, we use an image-guided anesthetic injection into the SI joint. If pain drops dramatically, the source is localized. Now here's the nuance. Different insurance companies require different relief thresholds. Some require 75% immediate pain relief to call it positive. Others accept 50%. That's bureaucratic. In practice, the higher the relief, the more confident we are that the SI joint region is driving your pain. But diagnostic blocks have limitations. Sometimes you can get false results. If you inject the joint, there can be leaking of anesthetic as you withdraw the needle that numbs the surrounding ligaments and connective tissues. If the pain is actually coming from those ligaments and not the joint, it'll go away and you'll think the injection proved the joint is the problem. That's a false positive. Before we move on, I need to mention red flags we never ignore. Never ignore new bowel or bladder changes, progressive weakness, night pain with weight loss, fever, or trauma in someone with osteoporosis. Those signs need to be evaluated by your doctor. Here's a simple 3-step roadmap you can take to your next doctor visit. Step 1. Describe your pattern clearly: where it starts, what triggers it, what relieves it. Step 2. Ask about conservative options first: targeted exercise, physical therapy, at-home remedies, posture, and anti-inflammatories. Step 3. If pain sources overlap or progress stalls, discuss if an image-guided diagnostic block is the next best step. Remember, knowledge replaces fear with control. Here's the mindset shift I want you to walk away with today. You are not fragile. You're simply under-coordinated and under-load for now. With the right movement cues and progressive rehab, sacroiliac pain is beatable. I've seen plenty of patients regain walking, lifting, and sleeping without that constant catch or throb. You can too. If this video finally gave you clarity, or words to ask your doctor for better answers, subscribe so you don't miss the next video, where we'll cover treatment strategies and explain why your exercise program might not be working. If you want to prepare now, grab the free SI joint symptom checklist in the description. It summarizes everything here on one page. I'm Dr. MovingBetter, and remember, movement isn't just medicine, it's your superpower.